sir.
Please start.
Okay.
Ah,
Started, sir.
okay.
Shall I start?
Start, sir.
Welcoming all of you for today's elite group discussion. See, for various obvious reasons, we are not getting the response from our members. Naturally, that disappoints us. All right, we cannot compel, it's only option. We wish every member to get fully benefited of the homeopathic system of medicine and know about it thoroughly. That is why we take most of our pain to express things and clarify things in a very detailed manner. In some cases, some repetition could have been there. But the idea is, the more and more you hear it, because of your age, you will be able to retain it, and it will make you remember at the time of needy circumstances, or it will, you get it recapitulated now and again, so that our lectures will be stuck up in our brain. Okay. Now, last week I said about the pain and management. I told you about the pain in the eyes, pain in the chest, pain in the rectum, and the pain in the teeth. Sir, what is the difference? You are telling the pain management, and you also say about other things, and the same medicines comes in. You may have a doubt. This is an analysis, because a disease has to be understood and attacked in a different angle. Not only that, you must have different angles, but you should not choose medicine suddenly on the statement of the patient. Why? Because you may err. That is what we don't want to. That is why we don't want to time and again tell you about homeopathic medicine and other things. Today, I'll try to take pain in the limb region, body region, and muscle region, etc. So they can be termed as different languages. In other words, you understand the situation not only by the medical name, medical term, or the person's expressions, as well as what you are supposed to understand. Yes. This pain in the limbs and other thing, you call it by rheumatism, gout, arthritis, etc., nowadays more nomenclatures, but they all put into the only one captain, the pain management. The hospitals also advertise only on the captain of pain management. In other words, they analyze each organ part as the case may be by virtue of this clinical test examinations. They inject the medicines according to the location of the pain. This is nothing but pain event. In between limbs, in between folds, they do in a different way. So that the medicine goes and attacks the subtle point or subtle area, thereby you are relieved of the pain. You may ask me, sir, is it going to be permanent and there is no coming back of the medicine? One cannot assure. The reason being, the medicine that is given is suppressio, suggestio, falsi. You inject the medicine, you push the medicine at the subtle point, so far the medicine is there, it will give you relief. But one thing I tell you, the earlier therapy is better now by way of the pain management because it lasts long. It may be steroid or it may be any powerful drug or any laser treatment as the case may be. Do you understand this point? Sir, in what way this homeopathic system helps? We do the same thing. You analyze, come to the reason, see what is patient is with miasmatic condition or chronic condition or acute condition or hereditary problem. With this background, we choose a medicine that is equal to administering medicine to the subtle point by overcoming the obstruction and vital force is rejuvenated, the affected party is given relief. This is only we are doing. So what is the difference between you and allopathic system of administration of medicine? There is subtle distinction. You all know the homeopathic medicine chosen based on the totality of symptoms as well as likes and dislikes, mind symptoms, etc. It gives you a correct clue as to the what is exactly the problem. Is it due to the hereditary problem, psora, psychosis, syphilinum, or as the case may be, and a chosen of drug tries to give you relieve the obstructions. It is not a steroid. It is only a medicine that helps the organ to come back to normal. This is how we do it. Rheumatism is what? Pain of unknown cause in the joints or muscle. This is simple. Acute rheumatism or rheumatic fever means pain associated with streptococcal infection. Genus of bacteria occurring in the chain-like formation in the subtle layers of joints, muscles, as the case may be. They are called septococcal bacilli. So this cause slowly first the pain, then you call it as rheumatism because pains, joints, small joints, etc., all get it. Then comes a still aggravated form, gout. It is a metabolic disease associated with excessive uric acid in the blood, characterized by painful inflammation and swelling of the smaller joint, especially big toe, big thumb, and etc., where deposits of urate in and around the joint takes place. You see gout patient, most of their legs and ankles, everything are swelling. Then comes arthritis. This is simple inflammation of joints due to osteoarthritis or pyrogenic arthritis. Infection of joints by pyrogenic organism, that is, organs producing pus, is called pyrogenic organism, resulting in pyrogenic arthritis. Thank you. Are you able to hear me? Hello? Hello?
Yes, sir. Yes, sir, you can talk.
Hello?
Hello.
Yes, sir. Yes, sir.
Yes, sir.
We are hearing, sir.
Yes, sir,
We
you
are
can
hearing,
talk.
sir.
His earphone is fallen.
ஏன் சார் ஏதாவது கான்டாக்ட் ட்ரபிள் இருக்கலாம் சார் கொஞ்சம்
Hello?
அது மட்டும்
Hello? Yes,
Ah,
yes.
yes.
Yes, I am back. I am back. 1 minute. Are you able to hear me?
Yes, yes, sir.
Yes, sir.
Yes.
Okay, okay. Thank you, thank you. Sorry for the distance.
No problem.
So now we know rheumatism, gout, arthritis. They are different nomenclatures. But basic thing is only pain. Pain, pain, pain. Some affection may be in different kinds. Then, what are the medicines for osteomyelitis or pain in the rheumatism? Bryonia, you all know. Rastox, Ledamol. When pain is aggravated on slightest motion and relieved by moderate pressure, it is bryonia. Ledum pulsate or ledum fall. It is a specific in gout and rheumatism. Aggravated form of rheumatism is gout. When the affection travels downward to upward, there is a deposit of chalk-like stones in the finger joints, etc., etc. That is, calcium is deposited. This gives us disturbance to the muscle thin layers, thereby preventing the fluid, that is the grease, from helping the joints to move. So it gets dried up because no energy or no material of grease is supplied. Then Calmia latifolium. For rheumatic pain, when affected with travels downward and causes numbness. On the left side, where there's a, on the left hand, where the pain travels downward with numbness, we correlate with the heart problem, disturbance to the heart. Though you take Crataegus, all other medicine, still the numbness persists, pain persists. Calmia latifolium is a striking example to remove all those pains in the left hand. Colchicum, good remedy for gout. Aversion to smell, soon after food is served. See, on the table we are being served with beautiful biryani. That itself will give you aversion. You understand the condition of the gout and rheumatic condition, and colchicum beautifully comes in. Bloated stomachs, abdomen, albumin in the urine, because I already said, in the gout, more urine will be, uric acid is accumulated, etc., etc. Slowly what happens? When it enters the entire body, the physicians take invasive action, like removing the water through kidneys or other organs from the body. That gives immense disturbance. Dialysis also one such process. Prostoc, recurring attack on getting chilled, particularly now, December you are going to get chilled. When there is an attack of pain in the joint recurringly, you can think of Prostoc. Rheumatism caused by damp weather. See, when rain is there continuously, it is not raining heavily, but drizzling all the time. That's called damp weather or damp climate. Or in the hilly region, there will be mist. It's called damp weather. So better by continued motion. So you can think of Prostoc. Up to 1 m potency is recommended. Cactus grandiflorus, rheumatism with dropsy, oedematous, swelling of extremities, kidneys, bowels affected, then cardiac rheumatism. So Cactus grandiflorus beautifully acts along with Crataegus. Stellaria mediterranean. It is indicated in the shifting of pains in the all parts with the soreness. Difference between pain and soreness. In the soreness, you don't feel pain, but most inconvenient, more than rest, worse than pain. Soreness is worse than pain. Mind becomes restless. Dulcamera. We already said when changes to hilly climates and other places, you go for Dulcamera because rheumatism with cold and wet condition and damp basement. Pulsatilla affects knees, ankles, small joints, hands, etc. Gayaka, very beautiful remedy in rheumatism and gout. Painful from warmth motion. That is, even you apply warm cloth or hot water, fermentation, if you feel pain is still there, Gayakam comes. Gayakim is also your soric remedy. Then, Lakapodi, rheumatism in a finger joint and flatulence, etc. Formic acid, gouty or rheumatism pain due to urate and albuminum and urea. So how do we know all these things? You must go for clinical analysis. That is why in the present homeopathic system of medicine also, the colleges teach you to know all the clinical methods. Calicorp is a very good medicine when burning characters, stitching pains and stabbing pain, relieved temporarily by cold application. When you apply cold cloth, you feel better. It covers painful part. Calcarea corp, very good remedy for a tardy development of bony tissue. Irregular nourishing of the bone. Pain in this remedy are relieved by constant walk. See, that is why we have been advised to have a walk so that the bones will become sturdy and strong. Magnesium muriaticum, when pains are worse by sitting, better by moving. Sciatic pulmonaris, Sticta pulmonaria, rheumatism of the right shoulder, blade or joint. Sarsaparilla, rheumatism in psychotic person. Berberis vulgaris, pain feels relieved by putting most of the weight on the painful side of the heels. Myristica sebifia, inflammation or suppression of the joints and other parts, pain in fingernail with phalanges. Chelidonium, rheumatism with edema, heat, tenderness and stiff. Like that, we can go for many remedies. We got benzoic acid, oxalic acid, and antimonium crudum for gout alternating with vomiting. Aconitum nephalis, shooting pain which are reproduced by wine or other stimulant. Actia racemosa, affecting the vertebral joint, especially the neck. When the rheumatism gets better, mental symptoms appear or diarrhea comes in. Actia spicata, tearing pains, drawing pains on the small joint. Actia racemosa actually acts on better in the right side. Like this, we got many more medicines. Hypericum is there, Merxol is there, Apismel for removing the poison is there, Medorinum, a very beautiful remedy, tried with well selected remedies tried. Syphilinum for rheumatism in syphilitic constitution. Lachesis, rheumatism pain in the knees and elbows, swelling of the knees, face become pale and bleeding. Pyrogen, it is also a septic removal medicine. Arnica, simple pain reliever. Anything comes in suddenly, you can think of arnica. Aurum metallicum. Pains wander from joint to joint. They are not constant at one place, joint to joint. Colophyllum, rheumatism of the short muscles, that is between two finger joints or finger nails, etc., where small muscles are joined. Petroleum, stitching pains in the heels. Urtica runs, gout accompanied with thick urine. See how the three concepts of rheumatism, gout and arthritis are being managed by homeopathy. You have got hundreds of medicines, intercadent medicine. Medicines that follow well also should be taken into. I think I made you more heavy by this question. But one thing I tell you, you are not escaping this the pain. Everybody is now going through this process of pain. Whatever be the age, they have to be affected, inflicted for various obvious reasons. Reasons being climatic condition, habitat, food habitat, abusing the body, as well as controlling the discipline of the management of the body. Thank you very much. I think this would have given you a very clear picture of pain management. Thank you. Over to Dr. Murthy. Murthy sir?
Sir, namaskaram. Is
Yeah.
my voice audible? Hello?
Yes, yes.
Yes, sir. Yes, sir.
Namaste, my dear homeopaths. Surendra Garu, thank you very much. You have taken so much of pain to tell about pain. Very excellent lecture. Please, already we are sending the recorded this one. You listen always again. Beautiful medicines he has selected. And from his selection of medicines, I will ask one question in the question hour. When Dulcamara can be given? When we will give not now, in question hour. The question I am leaking now. When Dulcamara you will give, along with Dulcamara, what are the medicines available in that season? Okay, this in the question hour I will ask. Now, last week I have taken renal calculi. So, for that, primary calculi is there, secondary calculi is there. For that also symptoms, ulceration will be there, obstruction, hemorrhage while urinating. These things we have, last week we have noted that one. Treatment to reduce the pain, first and fundamental means belladonna we have to give and repeat as and when required. Colicky pain when it is a right side means lycopodium, and abnormal unbearable pain means Osimum can you can give along with Berberis vulgaris. And Pereira breva, if Berberis vulgaris power is not there means we will give Pereira breva. Generally from my side I will give Berberis vulgaris morning, afternoon Pereira breva, night as per the symptoms what is available, either sarsaparilla or urtica urens, whatever it may be. Next, after Pereira breva, when there is a burning pain is there, then you have to go for Cantharis. If stitching pain is there, abnormal stinging and stitching pain is there, Apismel you have to go. If there is a white sediment, sarsaparilla you have to go. for red sediments, lycopodium. These sediments generally we will know through our pathological report. Natrum phos, after treatment is over, you ask the concerned person to take the natrum phos 6x in potency, minimum 2 months regularly, morning 4 pills, evening 4 pills. It prevents the formation of calculus. Along with this, I have discussed about renal calculi, Cordus mariana, Chelidonium, Chenopodium, Cyananthus. And last week I told you read this one. I'll ask questions this week. If not this week, next week I will ask. These 4 medicines are most important for senior citizen. Cordus, Chelidonium, Chenopodium, Cyananthus. Please note this one. Most probably this class I am asking about rheumatism. Next class I will ask all these things. Today I am taking cystitis. 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 Cystitis is the inflammation of the mucous lining of the urinary bladder. It is nothing but the inflammation of the urinary bladder. Characterized by redness, swelling, mucus secretion will be there. It occurs in 2 recognized forms, acute cystitis and chronic cystitis. The causes for this is by bacterial infection or septic infection, which produce inflammation of the bladder, or pus through urine. Pus through urine. The presence of some stones in the bladder also create this cystitis. Third one, some strong acting drugs in other therapies, when you have taken, the urinations will be retained in the body, the bladder, in a more than normal period, and the urine becomes acidic, irritant and corrosive. Because of that one only, burning sensation and stinging pain sensation will be there. And lastly, due to injury to the bladder, because footballs and cricket, so many things now, at that time also you may feel this one. General symptoms are frequent and constant desire to pass the urine, but after going to washroom, drop by drop only you can pass. Sharp cutting, tearing and shooting pains will be there during the urination. Passing of blood, sometimes passing of blood through urination. And crampy like pains in the lower abdomen persisting after bladder is emptied. After completing the urination, there will be crampy like pain in the lower abdomen. And another symptom is mucus, pus and albumin are present in large amount. This also we can see through pathological report only. Next, pain in the suprapubic region, radiating to all directions to the end of the penis, or wherever we are passing that one, down to thighs also. Worse by motion, when bladder is full, pain will be abnormal. Better after urination. At that time, in some symptoms will be there. For that, we are having excellent medicines. Generally, if pain is there and burning with greater straining while urination, Mercur is one of the best remedy. Mercur in 30 potency, comparatively less burning but greater straining while passing the urination. The 2 drop by drop. So Mercur is one of the best remedy, along with whatever we have seen bladder remedies that will continue here. And Pereira breva along with Berberis vulgaris, whenever pain is there, whenever pus is there and stones are there, everything, Berberis vulgaris, Lycopodium, Pereira breva, these 3 medicines will come together whenever the urinary problem is there due to kidney or due to bladder. Means these 3 medicines you have to remember: Berberis vulgaris, Lycopodium and Pereira breva. Pereira breva, please spelling you see P-A-R-E-I-R-A. Pereira breva, B-R-A-V-A. In boric you can see this one. It is one of the best remedy. Even elders, whenever they are having any urinary problem, you can take along with epismel or cantharis, whatever it may be. Pereira breva you can take for 5 days. If you take, that is sufficient and it will be streamlined. Next, Sarsaparilla. It is one of the useful remedy for chronic cystitis where scanty urination is there, and sandy urination, and white particles will be there in that. Severe pain at the end of the urination, along just like Cantharis. Next, terebinthina, one of the best remedy. Very difficult to pass the urine or expel the urine, and there will be bleeding also sometimes. At that time, terebinthina will be given. Terebinthina, one of the best remedy. Deeper pain is there. Not only terebinthina, not only working for gents, even ladies also, it will excellently work. In excretory system, terebinthina is one of the best remedy. In biosalts, we are having Calimur and Calisulf, Natramur and Natrasulf. These are the medicines where we can, depending upon the symptoms, we can take 15 days to 3, that is 2 weeks to 3 weeks continuously to stop the symptoms reappear again. So with this, cystitis is over. I think with this, our urinary bladder disorders or urinary disorders, everything is over. Next week, I may take menstrual disorders. Next week or the other next week. Most probably, next week I will come to the class. On next month, first Sunday, I want a leave. Please grant me. So, Suresh Kumar is there? Suresh sir?
Yes.
Yes sir, you can take. Afterwards, we will take question hour.
Hello, it is audible to everyone?
Yes sir, yes. You can proceed.
Okay. A very warm good evening to all the group members. We'll continue with the organ journey, and last Sunday we were going through the topic allopathy. We saw what is allopathy there. Definition wise, what are the merits and demerits also with reference to allopathy, and we were also going through the comparative study of allopathy and homeopathy. So we'll continue with that because we just left halfway down. So we'll continue with the comparative study and finish off that also here. So just to fast recapitulate what we talked about, the comparative study between allopathy and homeopathy. In brief and nutshell, we'll have. Yes. So allopathy, first point, we started that allos is dissimilar, whereas homeos is similar. This is the meaning of the terminology allos and homeos. The second point we talked about axiom, where allopathy do not have a fixed principle, whereas homeopathy has a fixed principle. Third, the point is in allopathy, there is no direct relationship between the drug and the disease, as well as the medicinal symptoms and the disease symptom. There is no relationship between the drug and disease and the medicinal symptoms and the disease symptom. There is no any relation, either similar nor opposite. Whereas in our system, the medicine produces symptoms similar to that of the disease. So this is the basically difference in the allopathy and homeopathy. Then we talked of the founder, where there is no founder or no inventor of the allopathic system, whereas Dr. Hahnemann himself has given the allopathic term to this science, and our science was established by Dr. Hahnemann, and homeopathic system was well known even before the Hahnemann, but it was established as a science of therapy by the provings of the Dr. Hahnemann. So it was termed as an established science after Dr. Hahnemann's paper presented to the world. So this is the other point we discuss in this comparison is there is no fixed principle to guide physician Sometimes they use heteropathy, sometimes you use antipathy, and it is purely basis of the experience of the physician only. Whereas in our system, it is has a scientific fixed principle which is deduced from the natural phenomena of the disease, which is true for all scientific laws, and that is including the law of similia, the underlying principle. The next point we discussed is in allopathy, disease is considered as a separate entity than the sufferer. So that's why they describe the disease in a different nosological heads. Whereas in our system, the disease is not considered different from the patient, sufferer, and our textbooks feature the disease picture together with the patient's picture to composite together as a totality. The seventh comparison is the generalization is the underlying scientific principle in allopathy, because patient belonging to a particular nosological head like cholera, pneumonia, whatever may be the condition, they are treated with a similar type of treatment is given in such similar conditions. Whereas in our system, it is not so. We believe and we strictly follow the principles of individualization, and we treat the patient under such scenario on the planes of individualization. So every patient, in case of cholera, in case of jaundice, in case of malaria, is considered to be as a separate entity, and as per the merits of the case, as per the case taking, the medicine is prescribed, not on the disease nosological terms or disease common symptoms. So this is another difference between the allopathy and homeopathy. Then in allopathic system, we also talk that the disease is considered to be the starting point from the day when there is a structural changes is there, or the tissue changes are there, and followed with the symptoms, exhibition outside the organism. So the purely a pathological phenomenon when is seen, the prescription is done. It is not so in our homeopathy. In homeopathy, we consider to be the qualitative change is the first focal point of the disease formation or disease emanation, and pathological changes or the tissue changes is considered to be subsequent stage. So there is a basically difference between the deviation, the vital force or qualitative change, and from that point to the that is structural changes or tissue changes where the pathology is being exhibited. So our disease emanation or assessment of the disease begins from the changes in the qualitative changes in the lifestyle, rather than the pathological investigation or pathological evidence of the disease. So this is the difference between the allopathy and homeopathy. Then coming to the next point in allopathy. In allopathy, more than one medicines are being prescribed. That is, polypharmacy is seen in the allopathic system. So multiple medicines are prescribed, each for one type of condition, each for one type of disease. So if a fever is there, fever medicine will be given. If the headache is there, headache will be given. Cold is there, cold will be given. Suppose sinus is there, there is a sinus medicine will be given. So like this, polypharmacy is be the phenomena and considering the whole human being. So prescription of single remedy is advocated in Organon by Dr. Hahnemann, and we each time based on the patient's totality, we prescribe only single remedy, and that's how our repertory is constructed. In our homeopathy repertorization process or the case taking, then
through repertory, where we choose a single remedy basis of the totality picture only. So in polypharmacy is the phenomena in allopathy, whereas single remedy is the phenomena in homeopathic prescription. So next important point is medicines are in allopathy, medicines are prescribed in crude dosage, that is based on the physiological action on the affected organ and tissues. So crude dosage we have seen nowadays the dosage has been there's 20 mg, 30 mg, 100 mg, 650 mg. Like that, the crude drug is being administered in quantity. In quantity, it has been enhanced and it is being administered on the patient. Very simple. I can say in fever, earlier we were using doses 250 mg. Nowadays, it is being standardized that in any fever, we use the paracetamol 650 mg. So crude medicine is being administered in quantified way. So that is also one of the drawback or the what is the underlying phenomena in the allopathic system. Whereas in our system, we prescribe the minimum dose from the very beginning. Our target, our underlying principle in organon, as said, let's prescribe the minimum dose always, and that
Yes, voice failure.
So is there any audio problem? Anybody is feeling?
No.
We are able to hear, no? Only Suresh is not good.
No sound.
From
No.
our side, it is okay, madam.
Check it. I will check it, sir, because suddenly I am not getting the audio. Okay, I'll check it.
I am also getting your problem.
Yeah, nothing.
Okay.
No voice at all.
I will
It's
check
off.
it, sir, because I am able to listen whatever you people are talking, but his audio I am not getting there. I will check it.
I think it's dropped out.
Murtida, there is some problem in that
Which one?
our
Suresh sir.
ah,
Suresh sir, net problem is there.
yes sir, yeah, somebody should continue.
You continue. Sir, any questions?
Yes,
Any questions?
yes.
Tell me, sir.
Do you want me to continue?
No. Any question hour we will start.
Or till he comes?
Till he comes, we will have some question hour.
So how is sciatica different from this rheumatic pain and others?
Yeah, I could not hear you properly. Rheumatic pain?
How is it different from sciatica? Sciatica is also almost similar
Yes,
to.
yes. Yes, sciatica is also there.
Okay.
I have told you
Hmm.
about formation of bacilli in the layers of the bone or infection in the muscles, etc. Similarly, in the sciatic nerve also, the affection takes place. Muscles also there. So the possibility of pain due to three conditions: nerves, muscles, and bone joints and other things. How this happens? See, blood circulation is there, lymphatic circulation is there. This will manage the energy to the different organs, including tissues of the bone cells, muscle cells, as well as nerve cells, neurons. Simultaneously, the lymphatic fluid also travels and tries to help the organs to function normally. When there is a derangement takes place for various reasons, because no one can predict things. We are not munis or jnanas or God to visualize the parts of the affected part from seeing the person. It has to come out explicitly by way of pain. Sciatic nerve, when it gets affected, nerve capillaries also get affected. It slowly creeps towards muscles and bones, because muscles and bones are also connected with nerves. Are you clarified?
Yes, sir. Yeah, actually, you are right. In fact, the sciatica, which I am presently feeling, is the pain actually travels down up to heel. Okay, so and it gives a pain. It gives a very uncomfortable feeling.
Gayakam is there. Rastas Brahana is there.
Yeah, I'm taking the Rastax. I'm taking.
Yes.
Then cyclosynth in the morning. Then Ridempal in the afternoon.
Okay.
Rastax in the night.
So Nephelium you worked up? Nephelium?
Which one, sir?
Nephelium.
Muthu will take care of. Now,
No,
Suresh will continue.
we will discuss this one. Suresh sir has come, he will continue. Actually, the sciatica and name is, it is imported from other therapy. It is not there. Coxalgia is there. Coxalgia means lower portion of the backside. From there, nerve it starts. So it will pain up to down. That generally we are calling sciatica, but coxalgia is more important. For that we are having the best remedy, Colosynth, Nephelium, Rustax. Morning, afternoon, evening for 10 to 15 days, it will set right. Next, Suresh sir, you can take it.
Okay. Okay, sorry, there was a network failure. I could not help. So we were discussing the difference between the allopathic system and homeopathic system. I said that in the allopathic system, the medicines are being administered in a crude form and crude dosage with quantity enhanced in order. In arithmetic progression, it increases. So, whereas in our system, we has administered very minimal dose, and that too in potentized form, which acts upon the central life principle. That is, it acts on this potentized medicine act on the central life principle qualitatively, where the disease is supposed to have origin or supposed to have started. So this is how we define the difference between the administration of the drug with reference to this. So in allopathic crude drug is been administered, whereas in our system we use potentized form of medicines. Then in allopathy, it tries to explain the different processes in the body, in health, in sickness, with reference to physiochemical reaction. So the allopathic system explains the disease process or the health in the parameters or with reference to chemical reactions that is occurring in the body. Whereas in our science, in homeopathic science, the process it explains, the homeopathic science explains the process on the basis of the vital biological reaction under the control of the central life principle, that is vital force, or otherwise we call it is also dynamics. So mainly we consider vital force deviation as the origin of the disease process, whereas in allopathic science the disease is explained in the form of chemical reaction, physiochemical reaction. They explain that way. Then in allopathic science, the action of the drugs are initially experimented on the lower animals, whereas in our system, the drug action is experimented on the healthy human being, and that is called drug proving. And the entire our materia medica is being evolved by the drug proving process, drug proving method. So we don't conduct our experimentations on the animals and lower animals. So purely the experiences of the human being, that too healthy human being, the experiences felt by the healthy human being upon the administration of the drug, that is been recorded, that is been confirmed and reconfirmed, and that's how the proving is done, and later on it is brought to the materia medica books. So this is also a difference between the two sciences. Then in allopathic science, it regards the disease as perceptible signs and symptoms, complex, known by its names, and it tries to remove the agonizing symptoms. Whereas there is no value given to the subjective mental symptoms, or subjective mental symptoms are considered least important in allopathic science. So only the perceptible signs and symptoms are being taken into consideration of the case analysis, and the least importance is given to the mental symptoms. Whereas in our system, we consider human being as a whole and some total of functional derangement, structural derangements, as well as the changes that is occurring in the mental plane also being recorded and considered as a total picture of the disease. So we build the picture of disease, not only the symptoms, recorded symptoms of the patient, but also the sensations, feelings of the internal affairs of the patient has been recorded, and is in total it has been cognized, and in total it is being considered. So this is also a difference in between the allopathic science and the homeopathic science. Then if you see into another difference, the allopathic science is considered to be as a palliative method of treatment. It can be basically used for all type of emergencies, accidents, and what's called greater where the greater pathological changes is advented there, where the immediate intervention is required. There allopathic science can be very handy and considered as a first aid immediately. But for the dynamic type of diseases, it proves to be sometimes failure. So that's why it is considered as a palliative method of treatment. Whereas in our system, our science, the curative method of our science is treatment through dynamic way. And by the dynamic way of treatment, we annihilate or remove the natural disease from the organism. So that's why our system, the cure is permanent and recovery is permanent. there is no suppression at all. So no palliation at all. So allopathy is a palliative system of science, whereas homeopathy is a curative system of science. That is also a difference between these two sciences. Then last point in this segment is allopathic science takes the segmental view instead of the holistic conception of the disease. I repeat, the allopathic system of science, they take the segmental view of the disease picture rather than the holistic conception of the disease. It associates disease with what's called particular points of the body and tries to treat them by parts, organ by organ, like that. They call that's called when the the liver is diseased, then when the kidney is diseased, then motive is to disease the particular organ or particular part of the things. Whereas in our science, holistic conception of the disease is that we consider as biological whole, not only a particular segmental view we choose. Of course, always consideration is organ is there, or consideration of part is there, but we consider the patient as a whole, and we don't consider a particular segment, particular part, or particular organ as a specific, but we have a holistic approach. So this is the difference between these two. There is a segmental approach in allopathy, whereas a holistic concepts in homeopathy. So this is about all difference which I have highlighted, or I have given a comparison between the two sciences. So this is how the organ has given the comparison between the two sciences. So with this we end the comparative study, and we'll go to another science system known as heteropathy. The heteropathy is a part of the allopathic system also only, and it means the treatment of the disease by unusual methods or no proper evaluated or established methods. Okay, so disease treatment by non-established methods is known as heteropathy. So examples: bloodletting in fevers, application of the leeches in inflammatory conditions, then cupping of the painful part of the organ, then acute punctures in case of the various diseases, applying the electric shocks in case of epilepsy or insanity, etc. Then application of the external application on the stomach in case of the vomiting, etc., etc. Like this, very unusual methods are being practiced in heteropathy. Of course, this system is not relevant now. It is not absolutely. It has been. This system is not practiced in any form, and for just information's sake, I have given. So sometimes this method, heteropathy method, works as a palliative method, but for treating the patient in his agony or in his distress, but it cannot be construed to be as a definite science, and that's why, because there is no specific fixed principle as underlying basis. So heteropathy science is for information's sake, I have told you. Then the other science, which is known as tautopathy, it means that tautopathy is a science treatment of the disease by the same drug potentized to remove the what is called sensitized state produced by the crude drug. Pardon me? I repeat, tautopathy tautopathy is a method of treatment of the drug disease by the same drug in a potentized form to remove the sensitized state produced by the crude drug. So, examples can be given for this. Surendra sir, switch off your mic. Surendra sir, switch off your mic.
Surendra
please.
sir.
Switch off your mic, please. Surendra sir. Yeah. So I was talking about the tautopathy science. It means the treatment of the drug disease by the same drug in the potentized form to remove the sensitized state produced by the crude drug. So using the same drug to treat the same type of disease. That is, examples can be given as bad effects of the chloromycetin are removed by the potentized chloromycetin. So bad effect of the chloromycetin is removed by the potentized chloromycetin. Then again, bad effects of the chloroform is removed from the potentized form of the potentized chloroform. The effect of the chloroform is being removed by the potentized chloroform. Then bad effects of the sulfur drug is being removed by the potentized sulfur. So these are the examples of the tautopathy science. So the same drug is used to remove the drug effect in a potentized form. So this is all about the tautopathic system of medicine. Then the last in this series, which Oregon talks about this, is mesmerism. Mesmerism is another science. It is discovered by the scientist Mesmer. Mesmer is a scientist who advocated it, or who founded the system. So that's why this science is known as mesmerism, and also known as this science is known as animal magnetism also. Mesmerism is also known as animal magnetism. So it is a therapeutic method of a communication of a human power. It is a therapeutic method of a communication of a human power upon the human organism powerfully exerting his will. So this is how the mesmerism is conducted or done. So it is a communication of a human power upon a particular human individual by well-intentioned person powerfully exerting his will. So this is the way how the mesmerism is being carried out. So this is sometimes this is also seen, mesmerism practice has been conducted some parts of the world, but predominantly it is not practiced in anywhere. Very rarely in some countries this mesmerism is adopted and done. So I have given fairly an input about the different sciences which was previously existing and which is not practiced now, and the popularly practiced medicine system, allopathy and homeopathy, which is now widely accepted by all over the world. So I have given a fair input about the different sciences. Also, I have talked about the comparison between this homeopathy as well as allopathy, so that a fair understanding about these two science is well known to us. That's basically one, because why this is important, that we all are sympathizers, or we are the followers of homeopathy. We should know about the positivities of this science. What are the plus points of this science? Okay, that's why this is important. Further, many times a new patient comes, a new person is not aware about our science, and to them we can explain what is our science, how our science works. So in our certain clinical times, I have come across the people
Murthy sir, network failure.
Network failure.
Please continue your.
Any questions, sir? Any questions? In rheumatism, seasonal rheumatism, our Surendra sir has told about Dulcamara. When you will give Dulcamara, along with that, what are the secondary drugs or supporting drugs available in the homeopathy? That is my question. Because you have not asked any question, I am asking. Please answer.
Sir, we can give Rustox and Netral Sulf.
Okay. Okay.
Pulsatilla we can give, sir? Pulsatilla?
Yes. Two medicines have come. One more medicine, more important medicine is that several times I told you, seasonal rheumatism or rheumatoid arthritis, whatever it may be, at that time we will say, if we select Dulcamara along with what is the supporting drug or what is the secondary drug available in homeopathy.
The Rustox will do, sir, Rustox.
Rustox general, night aggravation, unable to sleep, unable to lay down, you want to move on. At that time, restlessness and anxiety, fear, and so many things will be there in the Rustox. At that time, generally we will give Rustox. Dulcamara, what's that?
Ledempal?
Ledempal also we can give, but only Surendra sir has told about seasonal drug. Dulcamara will be given the hill areas or seasonal drug. Whenever winter or rainy season comes, at that time the rheumatism pains will be more. So at that time we can give Dulcamara. Along with that, what are the medicines available? Supporting and secondary.
Baptisia, can we give, sir? Baptisia.
Baptisia is also one of the remedy. See, question is seasonal. He has told about seasonal. For that I am asking. Seasonal. So we are having Dulcamara. The second one is rhododendron.
Veritacur.
Rhododendron.
Rhododendron.
Rhododendron. RHODODENDRON. Rhododendron. The third one, you can select Pulsatilla or Rustox depending upon the symptoms. Pulsatilla means variations will be there. Sometimes in this way, sometimes that way, sometimes upper extremities, sometimes lower extremities, ever changing symptoms. Pain will be changing from here to there. At that time, Pulsatilla, the pains unable to make him to sleep. At that time, Rustox. The third drug, you can select according to the general symptoms.
So Stellaria is also for shifting pain.
Shifting, Stellaria, Pulsatilla, all are one category. Because instead of
Stellaria
going
also
Stellaria,
shifting
Pulsatilla
pain.
is a polycyst. So Pulsatilla will make you fearless also. So many things will be there. Okay. So my question is over. Next, any question from your side? Otherwise, I will ask one more question. All of you are masters of rheumatism and rheumatoid arthritis or pain relieving medicines. Now I am asking one question. What are the medicines available for small joint pains? Small joint pains.
Ruta can we use it?
Yes, very good, excellent. Then
Calcarea carb. Calcarea carb.
Calcarea carb. Will you give the preference to Calcarea carb for pain? First preference. Of course, it is one of the pain, but it is not the primary.
Ledum pal also can be used.
Hypericum.
No, I am asking small joints. Where are the small joints? All fingers are small joints.
Fingers and
Wrist is small joint.
feet.
Feet fingers are small joints. In this area, specifically, certain people will have pain. What are the medicines available? If I give chance to you, please ask the questions. You will not ask question. If I ask the question, answer you will not tell. What to do? So Actia spicata is the primary drug. Actia,
Arnica, sir.
Actia, no. Actia spicata is primary drug for small joint pains.
What is the spelling, sir?
ACTA, Actia spicta, SPICTA. Actia spicta, you read very small drug. It will only symptom is small joints. Actia spicta, ACTA, SPICTA, spicta. Lalita madam is not there. Spelling. So Actia spicata. Second one is Caulophyllum, CAULOPHYLLUM. Caulophyllum, Caulophyllum. The third one is the most important, Ruta, RUTA. These are the drugs for small joint pains. So, if no questions from your side means we will close the class. So, happy Dasara to each and everybody. Happy Dasara, Navaratri. Okay, sir. Thank you very much.
Okay, sir.
We'll meet next week.
Sure.
Thank you.
Sure. Happy Dasara.
Thank you, sir.
Happy Durga Puja.
Thank you, sir.
Happy.
Wish you all.
Sir, you can close.